The home care service has been a long-running service and existed for quite a long time. The emergency home care service is a bit of a more unique specialist service. They respond to falls, emergency situations and home care alarms predominantly within East Lothian. So the emergency care alarms are triggered through various methods. It can be motion sensitive, so there's sensors in people's houses, it can be buttons or cords pulled. There's actually motion sensors on doors and windows as well in some cases, which then produce a response from the emergency home care service.
Our job's a small team that reacts to the community alarm of residents in East Lothian. We're based in a community hospital, but we go from Coburn's Path to Musselburgh, Humby to Portsea, and we cover the whole of East Lothian.
So the aim of the emergency home care is to assist people to remain living independently within their own homes and actually reaching the potential and living the lives that they deserve to live and choose to live. Once they've responded, once they've assessed the situation, responded, got the person onto their feet and got them back up into a safe position, they'll assess any potential follow-up so they can make referrals on to other health professionals such as occupational therapists, physiotherapists, GPs and such like.
What we do with our onward referral is making people independent living at home. It's a very rewarding job. You're looking after people who just need a wee bit of help. You're looking after it all.
Part of the emergency home care service, they provide palliative care for clients within their own home, so support people to remain at home at the last stages of their life, and part of that is to make people as comfortable and safe and supported and to live a dignified end to their life in the way that people would choose to live within their own home.
We take stress away from families, we care for our clients with respect, we go in and we look after their family member. We've
got an ageing population in East Lothian, so the requirements and needs of the service have significantly increased, and in response to that we are in the process and will very soon be introducing an increased service that will be a 24-hour service, 365 days a year, that provides emergency response to that ageing population, again to support them to remain within their communities.
So Hospital to Home was a government funded scheme that was set up in 2014. And Hospital to Home allows us to discharge medically fit patients from hospital into our care so that they're home, which releases beds in hospitals. So we first started off with one travel route and 3 carers, and at present we now have 11 runs and we have over 50 carers. Hospital to Home uses a rehabilitation approach which allows us to review all our patients, the band 6s that work with Hospital to Home. We review on a continual basis. We do have feedback from the carers, but when we go out and do a review, this allows us to see whether the packages of care need to be increased or if they need to be decreased. We also work with GPs, OTs, who also review as well on a daily basis. We work with them as well, so this allows us to see where we can move people on, rehabilitating them, or if we need to increase their package and they wait for a care provider to take on.
They may find themselves having been discharged from hospital. They come into our care and we give them the same standard of care as they would receive in the hospital, which is good for them because they're now in their own home. Makes them feel comfortable, they know their own surroundings, and it's good for family members as well. Brings all the family back together again in one place. I think the positivity is tenfold, and the difference that you see in these people when they are home from when they were in the hospital is immense.
It's given me my independence and I'm able to do things that I couldn't do before, and that they're all so nice and they're obliging, and if it wasn't for them I'd still be in a hospital bed.
We have a really good team here in Hospital to Home. When I first started 7 years ago there were only a half a dozen of us, I now find myself in the middle of 50-something people. We make a big difference to people and their lives and their families. Seeing people who have came home fairly ill, not very independent, and we've guided them onto a path where they are now much better and more independent. And I don't think there can be a greater satisfaction than seeing someone progress that way, you know, physically with your own eyes, with your own help.
They're so helpful and understanding. That's what I like about it. I wouldn't have a word said against them. I enjoyed my time at Haddington. I was glad to get home.